So Harvard women, not men, Harvard women did the research and look at what are the things we can do. You can give me the excuse of diet, you can give me the excuse of exercise. They have not been shown to significantly reduce prostate enlargement. My testosterone gets converted to what is called DHT. That DHT is the only source of food for my prostate. The only exercise my prostate gets is erection. Therefore, me, I don't have any other alternative than to ejaculate. So the study came out that if men ejaculate 4 to 7 times a month, they have 30% increased risk of prostate problem. But if they get up to 18 to 21, their prostate risk disappears.
All right, if you're a guy or, you're close to one, chances are you've heard about prostate issues. They seem to pop up as men get older.
Yeah, it's a really common concern.
It is, and it makes you wonder, can you actually do anything to prevent prostate enlargement in the first place? That's what we're going to dig into today.
Exactly, that's the mission. We're talking about benign prostatic hyperplasia, BPH. It's a pretty significant health topic for men.
Right.
And we've got your sources here, including some really good insights from a urologist. And we're just going to try and cut through the noise.
Get to the useful stuff.
Yeah, get to the core actionable info on the how and why of prevention. That's the goal today.
Okay, let's start right at the beginning then. For anyone who might be newer to this, what is the prostate? And BPH, what does that actually mean?
Good place to start. So the prostate, it's this small kind of walnut-shaped gland, right? It sits just underneath the bladder, and it wraps around the urethra. That's the tube urine flows through. Now, BPH, benign prostatic hyperplasia, it's an increase in the number of cells in the prostate.
So, more cells are growing than should be.
Precisely. Instead of that nice balance, old cells dying off, new ones replacing them, you just get an accumulation. Too much growth.
And that can lead to other issues down the line.
Well, the enlargement itself causes the main urinary symptoms, but yeah, sometimes this overgrowth can progress to abnormal cells later on. Though BPH itself, it's important to say, is non-cancerous. Benign means non-cancerous.
Got it. Okay. Now, I know it's linked to hormones like testosterone, isn't it? But I've also heard this kind of paradox that even when men's testosterone levels naturally go down with age, the prostate often keeps growing. How does that work?
Yeah, that's a really sharp observation, and it points to how complex this is. It's not just about testosterone levels overall.
Right.
Early prostate growth, like through puberty and young adulthood, that is very much driven by androgens, like testosterone. But inside the prostate, testosterone gets converted by an enzyme, 5-alpha reductase, into DHT, dihydrotestosterone. It's a much more potent form.
Ah, okay. So DHT is the driver.
It's a major driver of growth, yes. But like you said, the prostate keeps growing even when total testosterone drops. So it tells us androgens, while important, they aren't the only thing causing BPH later in life.
So what else is going on?
Well, what's really fascinating, fundamentally, BPH is down to a cellular imbalance. Think of it like a population boom in the prostate cells.
Okay.
More cells are growing, specifically these epithelial and stromal cells, that are dying off through natural processes.
And what triggers that imbalance?
It seems to be driven by an increase in certain chemicals, growth factors. These are like little messenger molecules telling the cells, grow, multiply.
Things like EGF, IGF.
Exactly. Epidermal growth factor, insulin-like growth factor, keratinocyte growth factor, and also TGF-beta, transforming growth factor beta. These all play a role in signaling more growth.
That sounds like a fundamental issue at the cellular level. Is it just random, or are there things that kickstart it? Can we influence it?
It's not entirely random. There's definitely a genetic piece to the puzzle.
Ah, so it can run in families.
It can, yeah. It can be inherited in an autosomal dominant pattern. So if your father, say, had significant BPH symptoms needing surgery before he hit 60, your own risk is higher. Doesn't guarantee it, but the likelihood goes up.
Okay. Genetics. What else?
And that brings us to another really critical factor, inflammation.
We hear that word a lot, inflammation.
We do. And its causes here are pretty diverse. It could be from, low-grade bacterial or viral infections, changes in hormones, autoimmune reactions, even urine maybe refluxing back into the prostate ducts.
Urine getting back in there.
Yeah, potentially irritating the tissue. And even disruptions in the prostate's own microbiome, the community of bacteria living there. We're still figuring that out, but it looks like microbiome changes can fuel inflammation too.
Wow. And how does inflammation actually connect to the growth part of BPH?
It can create this kind of vicious cycle.
Uh-oh.
So inflammation means your immune system is sending out alert signals,
Right.
chemicals called cytokines.
Like IL-6.
Exactly. Interleukin-6 is a key one here. But these cytokines, they don't just fight infection. They can also stimulate those growth factors we just talked about.
Oh, so the inflammation itself tells cells to grow more?
Bingo. More growth.
Yeah.
Then that extra tissue growth can lead to areas with low oxygen called hypoxia.
Right.
And that hypoxia triggers the release of more inflammatory markers. So you get more growth, which leads to more inflammation, which leads to more growth.
Yeah.
It feeds itself.
Man, that really does sound like a runaway train. It seems so complex, like untangling a knot. Can that cycle even be broken or slowed down?
Well, that's where the preventative strategies come in, which we'll get to. But one last point on mechanisms. Some BPH symptoms aren't just from size, but also from increased smooth muscle tone in the prostate. Yeah, the prostate has smooth muscle in it. This tone is regulated by the sympathetic nervous system, think fight or flight. And things like big swings in blood sugar, high or low, your diet, and being obese can actually ramp up that muscle tone, making urinary symptoms worse.
Okay, so we've got the hormones, the cell imbalance, growth factors, genetics, that whole inflammation cycle, and even muscle tone. That's a lot going on in there.
It really is. It's multifactorial.
All right, so we've unpacked the complex why. Now, for you listening, this is maybe the most important part. What practical, evidence-based actions can you actually take? What did the sources say?
Absolutely. And the good news is there are clear strategies, and honestly, they overlap a lot with just general good health.
Okay, what's the first one?
The first big one is try to avoid developing metabolic syndrome.
Metabolic syndrome. Remind us what that includes.
It's that cluster of conditions. Things like diabetes or pre-diabetes, high cholesterol, high blood pressure. Often they show up together.
And often linked to diet and lifestyle, right?
Very much so. Often linked to the typical Western diet. You know, high in processed fats, red meat, simple carbs, lots of sugar, combined with not enough physical activity.
And the connection to prostate health. How strong is it? The numbers you found were pretty striking.
They really are.
Yeah.
They definitely drive the point home. Get this. Having diabetes increases your risk for benign prostatic enlargement, the actual size increase by a huge 125%.
Wow, more than double the risk.
Exactly. And it increases the risk of having those lower urinary tract symptoms, LUTS, the weak stream, going often, urgency by 95%.
Almost double the risk for symptoms too. That's significant.
It's massive. It really shows how tied our metabolic health is to our prostate health.
And it's not only diabetes, is it? Body weight itself plays a role. BMI, waist size.
Definitely. Looking at BMI, body mass index, having a BMI over 35 compared to someone under 25, that increases the risk of BPE, the enlargement, by over 200%.
200%.
Yeah. And waist circumference is another big one. A waist measurement of 109 centimeters, that's about 42 inches, ups the BPH risk by 138%. Even 102 centimeters, around 40 inches, increases risk by nearly 50%.
So the message is pretty clear. Managing weight, blood sugar, blood pressure. It's critical not just for your heart, but for your prostate too.
Absolutely critical. Which leads directly into the second key strategy.
Let me guess. Move more.
You got it. Increase physical activity.
Now, this seems like, common sense for overall health, but is the evidence specifically for prostate health really strong?
Oh, it's incredibly strong. Really compelling stuff. There was a big review, looked at 8 studies covering over 355,000 men. Huge numbers.
Okay. What did it find?
I found that even light exercise, we're not talking about training for a marathon here, just light activity decreased the risk of developing BPH by 30%.
30% just from light exercise? That's amazing.
It is. And if you did more moderate or vigorous activity, the risk reduction went up to 36%.
That makes prevention seem much more achievable. Any specific examples, like how much is light exercise?
Yeah, one study showed that just walking for more than 2 hours a week, that breaks down to less than 20 minutes a day, cut BPH risk by 27%.
Less than 20 minutes of walking a day. Most people could manage that.
Right. And another one, the Massachusetts Aging Study, found that men burning about 862 kilocalories a day through activity had almost a 50% lower risk.
Half the risk.
And other large population studies found similar things. Regular activity, maybe around 6 times a week, cut risk by about 51%. The evidence is just undeniable. Get moving.
Okay, so avoid metabolic syndrome, get more active. What's next? You mentioned something about medications.
Yeah, this one's slightly different. It's maybe less about pure prevention of enlargement, but it's really crucial for managing symptoms if they do start. The point is to avoid certain medications that can make urinary problems worse.
Okay, so things that might interfere.
Exactly, like common antihistamines. They can relax your bladder muscle too much.
Making it harder to empty.
Right, especially if the prostate's already obstructing things a bit. And decongestants, particularly pseudoephedrine, found in lots of cold meds.
What did they do?
They can tighten the smooth muscles around the bladder neck and in the prostate itself, which is the opposite of what BPH drugs like alpha blockers, say Flomax, are trying to do.
So they counteract the treatment?
They can, yeah. And also, certain older antidepressants, the tricyclics, they can negatively affect bladder function too.
Yeah.
So it's just something to be aware of, especially if you start having symptoms. Talk to your doctor about all the meds you take, even over-the-counter ones.
Good advice. Okay, number 4. Let's talk diet. This one always feels complicated.
It is. Diet research is notoriously tricky, right?
Yeah.
So many variables, hard to track accurately long-term.
Yeah.
But probably the most robust data we have specifically looking at diet and BPH prevention comes from a huge study called the Prostate Cancer Prevention Trial, the PCPT.
Okay, PCPT, what made that one so good?
Well, it followed over 18,000 men for 7 years. And they used really detailed food frequency questionnaires to track what these guys were eating pretty rigorously.
7 years, 18,000 men. That's solid. What did they find?
Some really interesting things. First, total fat intake. Men who got over 38% of their daily calories from fat had a 31% increased risk of BPH compared to men who got less than 26% from fat.
So higher total fat was linked to higher risk. Did the type of fat matter? Saturated, unsaturated?
You know, surprisingly, in this study, it didn't seem to make a significant difference. Whether it was polyunsaturated, monounsaturated, or saturated fat, the link was really with the total amount of fat consumed.
Interesting. Okay, what about protein, red meat specifically?
Yeah, they looked at that too. Men who ate red meat every day had a 30% higher risk of BPH compared to guys eating it less than once a week.
Daily red meat linked to higher risk. And vegetables.
The vegetables show the opposite effect, as you might expect. Men eating less than 1 serving of vegetables per day had a 38% increased risk compared to those eating 4 or more servings a day.
So low vegetable intake is bad news.
Definitely. So the big picture takeaway from PCPT on diet is high total fat, high red meat, and low vegetable intake all seem to increase your risk of developing BPH.
That really points towards a more plant-forward, lower-fat pattern, doesn't it?
It does, which ties into avoiding metabolic syndrome too, of course.
Makes sense. Now, you also pulled out something specific. Lycopene. What's the deal with lycopene? I associate that with tomatoes.
That's right. Lycopene is a carotenoid. It's that pigment that makes tomatoes red, also found in things like watermelon and pink grapefruit. And it's known for being a powerful antioxidant and anti-inflammatory agent.
And did the PCPT study look at lycopene?
It did. And it found about an 18% reduction in BPH risk associated with dietary lycopene intake. Now, it's fair to say other studies have had mixed results on lycopene supplements, but for dietary intake, this big trial showed a benefit for prevention.
18% reduction, that's still pretty good.
It is. And what's really interesting is how you consume it might matter. There's some evidence suggesting that cooking tomatoes, like when you make tomato paste or sauce, might actually enhance lycopene's effects.
Cooking helps. How?
It seems to be related to the Maillard reaction, that browning process when you cook food.
Right. Gives flavor.
Exactly. Well, a specific reaction within that, involving fructose and histidine, seems to create additional antioxidant compounds that might work alongside the lycopene.
Huh. So pasta sauce could be better than a raw tomato for this?
Potentially, yeah. It's quite fascinating.
How much lycopene are we talking about? What kind of intake showed that benefit?
The studies generally looked at intakes ranging from about 6 up to 21 milligrams per day.
And what does that look like in food terms?
Well, a cup of tomato paste is packed with it, around 19 milligrams. A good slice of watermelon might have about 13 milligrams. A cup of cherry tomatoes, maybe closer to 3.8 milligrams. So you can definitely get it from food.
Seems achievable. But
Yeah.
You mentioned a caution.
Yes, very important. While tomatoes are great, you don't want to go overboard. Eating too many tomato products can cause issues for some people.
Like what?
Things like triggering irritable bowel syndrome or bladder overactivity tomatoes can be bladder irritants for some. GERD or acid reflux is another common one.
Okay.
And in really rare cases, extremely high intake has been linked to things like kidney problems, body aches, or even a harmless skin discoloration called lycopenidermia, where your skin turns a bit orangey.
Orangey okay, so moderation is key.
Absolutely. Enjoy tomatoes and their products, but don't, drink gallons of tomato juice every day. Thinking more is always better. Balance.
Right, so if we tie all the dietary threads together, the fat, the meat, the veg, the lycopene, what's the overall recommendation?
Well, putting it all together, the strongest evidence really points towards adopting a pattern like the Mediterranean diet.
High in vegetables, fruits.
Exactly. High in vegetables, fruits, using healthy fats like olive oil, eating smaller amounts of lean meat and fish.
And that kind of diet also helps with.
It also helps you avoid or manage those other conditions we talked about: diabetes, high blood pressure, obesity, which are themselves major risk factors for BPH. It all connects.
It really does seem to come back to those foundational healthy habits.
Pretty much.
Okay, this has been incredibly helpful, really breaking down the research. So if we were to boil it all down, the biggest takeaways from these sources seem to be:
I think without a doubt, the most impactful, evidence-backed things you can do are significantly increasing your physical activity.
even light activity makes a difference.
Even light activity helps, yes. And adopting that Mediterranean-style eating pattern. Those two stand out as having the strongest support for reducing your long-term risk of prostate enlargement.
More movement, more plants, and healthy fats, less red meat and total fat.
That sums it up pretty well.
Fantastic. So maybe a final thought for everyone listening.
Yeah, perhaps think about this. Given how much these lifestyle choices seem to impact not just your prostate, but your overall health and well-being, what's one small, actually sustainable change you can maybe make this week?
Just one small thing.
Just one step towards being more active or shifting your plate slightly towards that Mediterranean pattern. How might starting that one small thing ripple outwards into other parts of your health journey? Something to chew on.
Well, prostate cancer affects 1 in 8 men during their lifetime. That is not a small number of people. If you look at my subscriber base, I have nearly 400,000 subscribers. Of them, 90% are men. And if you even go with a rate of 1 in 10, because not everyone is in the United States, where that number is 1 in 8, and some countries have a lower incidence of prostate cancer, you can estimate that at least 30,000 of the people who follow me or subscribe to me will develop prostate cancer. That's a large number of people. So yeah, if we can modify something in our own behavior that can help reduce prostate cancer risk, well, why not? Why would ejaculation have anything to do with prostate cancer? Well, for those of you who don't know, the prostate's primary function is to create a fluid that you secrete during ejaculation that actually nourishes and protects sperm. And so that fluid essentially builds up in the prostate in between ejaculations. There are a few theories as to why ejaculation may be correlated with prostate cancer or not having enough ejaculation. And the number one predominant theory is called the prostate stagnation hypothesis. And what that is that over time, if you're not releasing that fluid, you can get carcinogenic secretions or secretions that are concerning for cancer promotion. And that actually can then cause the development of prostate cancer. There are also some other theories that may be that when you're ejaculating more frequently, you may have lower psychological stress, which can also be correlated with developing cancers. And the last theory is that having normal rates of ejaculation or more frequent ejaculation allows for what we call a normal prostate microbiome and also normal function of the prostate cells in regards to zinc and citrate metabolism, which are important for prevention of prostate cancer. So at the end of the day, there are reasons why people thought this was an interesting question to study. And what did they actually do to study this? So there's a couple really interesting things. This study was actually a survey done of over 40,000 men in 1992, and they followed these men up until 2010. And why is this important? Well, prostate cancer is a really slow growing disease. And so what that means is that you have to follow people over greater than 10 years to really see if the thing that you're seeing 10 years prior actually made a difference on their development of prostate cancer. And so they took men and they had them answer a number of different questions. And one of them was about, on average, how many ejaculations did you have per month during these 10 years? And the 10 years were between ages of 20 to 29, 40 to 49, so on and so forth. And so people had to kind of think back and remember and estimate how often they were ejaculating during that decade of life. And these men were asked to take surveys every other month. They also asked them about their physical activity level, their weight, their smoking history, if they ate processed meat, tomato-based products, alpha-linoleic acid, if they've ever used a multivitamin, if they had life stressors like divorce going on, and just a number of different questions. So they did try to control for all these factors in the final analysis to determine if ejaculation frequency was indeed correlated with a lower risk of prostate cancer. And one important thing that came out of the study is they actually saw what ejaculation frequency was in this large cohort of men over decades of life. And it was very common to see that ejaculation frequency decreased with age. So when they looked at men who had ejaculated at least 13 times per month between the decades of 20 to 29, about 57% of men said that they had ejaculated at least 13 times or greater. But that dropped down to about 32% at the age of 40 to 49. So then when they looked at all the data, they kind of categorized all these men into different categories. And those that ejaculated 0 to 3 times, there were very few men that fell into that category, so they didn't use that as their comparison. And so they then compared those who ejaculated 21 times or more to those who ejaculated 4 to 7 times per month. I mean, 21 times is a lot. That's like 5 or more times a week to ejaculate, right? That's a lot of time to ejaculate. And so by the time they looked at all this data, these men were on average about 59 years of age, and they saw that the men who ejaculated between the ages of 20 and 29 and 40 to 49 who ejaculated 21 times or more compared to those who ejaculated 4 to 7 times had a 20% less likelihood of getting a low-risk prostate cancer. This wasn't true for high-risk prostate cancer or more aggressive prostate cancers with metastasis, but certainly a low-risk prostate cancer, they were 20% less likely to get this diagnosis. So the reason I brought this study up, the study was done in 2016, but the reason I wanted to talk about it today was because I just started seeing news articles posting about this paper again about 2 weeks ago. And so I said, you know what, let's talk about this, because all the articles just said ejaculate more often. So is that what you really should do? Well, I think you have to look at these studies critically. And this was a really well-designed study. They followed people for a long period of time. They had really an excellent team of researchers and statisticians, and they controlled for a lot of different factors that might also be causing a lower risk of prostate cancer. But you have to think about it. Those who are ejaculating 21 times or more every month are probably either a different type of person altogether than someone who's ejaculating 4 to 7 times. They might be more physically active or more physically fit, so they're having more intercourse more often. So I think the real question is, should you start ejaculating more often based on the data of this study? Well, I would say that while this is a really well done study and they controlled for a lot of factors like physical activity, stress, food intake, carcinogens in food, lots of things like that, it's still not 100% sure or clear to me that we should be prescribing all men to ejaculate 21 times a month so that they don't get prostate cancer. I think it's an important question. I think that if you are ejaculating very often, I think that that's not a bad thing, and you can certainly continue to do that. And if you're holding back because you think it's bad for you, well, probably it's not bad for you, and you can go ahead and ejaculate more often.